Hello everyone. This is midwife Sally, and as usual, once I come on, then it means that I'm going to talk about pregnancy, I'm going to talk about labor, and I'm going to talk about delivery. This afternoon, in honor of my late dad, I want us to talk about how to prevent maternal mortality. How to prevent maternal mortality. How do you make sure that you take care of yourself and you don't become a victim of maternal mortality? Yes, it's unfortunate that right now, if you are pregnant, you are scared to go on social media, you are scared to be in moms groups and all that, because people are sharing posts that will scare you. And so that is why I want us to talk about simple things you can do to save yourself. I always say most of these deaths that occur in our hospitals are preventable. Some of the things are as a result of things that we do as mothers. Some may be due to facility problems, but I want us to concentrate on what we can do. Yes, what we can do ourselves as moms. Like, what can we do to prevent the situation, to prevent us from dying? Let me just be as plain as possible. 1, report to the hospital early. Yes, I have seen a case where the woman did not report early, and the first time she was brought to the hospital, she had an ectopic. So many of them are coming. She had an ectopic. It was an emergency after the cesarean. After the laparotomy, she couldn't make it. We had a case where a teenager was brought. The teenager was brought to the hospital around 5 months. Yes, she was brought around 5 months and she couldn't make it. Yes, and so these are all examples of things that we see in the hospital. She came and she was being rushed because she had collapsed at the hospital. Obviously, it was pre-eclampsia or eclampsia. She fitted, and that was it. Yes, and so in these instances, you can never blame the hospital. So if you are pregnant, make sure you go to the hospital as soon as possible. Like, report early. Make sure you've done your early scan, you've seen your midwife, you have done whatever you are supposed to do. And report early when you start seeing certain complications, things you're not familiar with. All of a sudden, your waters have broken. All of a sudden, you're having this unusual headache. All of a sudden, you feel in your spirit that something is just not right. Don't wait for something to happen before you report. One thing I would also say is that don't miss your appointment. Yes, for some people, the doctor has given you 4 weeks or 3 weeks, and because you feel okay, or you are okay, you are like, okay, so it's just 2 weeks, I'm fine, so I wouldn't go to the hospital again, or I would wait for the next week. No. Things like, let's say, high BP, even if you're having previa, if they don't do a scan, they wouldn't see. If they don't check your BP, they wouldn't know. So if you're just at home thinking all is well, we have seen women who have been rushed to the hospital with severe bleeding. Maybe they had placenta previa, but they never took a scan, and now abruptio is separating from the walls of the uterus. So the woman is having massive bleeding. Her life is at stake. The life of the baby is at stake. So this is something that was caused in one way or the other by the woman's own doing, because you did not report to the hospital. Yes, so your appointment, make sure you follow it. And one thing I always tell my clients, especially those in my class, is that you should always, at all times, you should advocate for yourself. When I say advocate for yourself, there are some moms who will come to the hospital, whatever is going on in your book. And sometimes I get to wonder. Yes, please don't think too far. These are the realities. I'm still practicing, so I know what I'm talking about. She has little or no idea about what is going on in her antenatal book. Don't tell me that the midwife should know, the doctor should know, the nurse should know. What if there are too many people at the hospital at that time, and because of that they couldn't recognize some of these things? Things are things are happening, and some of these things it happens, and then you think about it and ask yourself, how was this possible? Yes, but it has happened. So I advise that if you are pregnant, advocate for yourself. The midwife is saying this, you don't understand, seek further explanation. If you think what he has said is not convincing, seek a second opinion. Maybe you told the midwife you can't feel your baby move, and she's saying that it doesn't matter, but you're not convinced. You realize that no, just seek a second opinion from another facility or from another nurse. Please do it. Yes, it has really saved the lives of so many people, and so I know exactly what I'm talking about. So seek a second opinion when you need it. Yes, don't over rely on nurses and doctors. Sometimes your life should be your own responsibility. And sometimes I recently spoke to a woman who was asking for a referral. She's given birth to five times without problems, and this one she was saying that no, I can't make it myself. And midwives were like, you can make it, you can make it. She nearly lost her life. So sometimes what you say is relevant. Don't think that they know everything. Yes, at the end of the day, they did exactly what she said she wanted, but then it was a bit too late. So we need to take some of these things into consideration. You should be able to advocate for yourself. Okay, so I've been here for 24 hours and the baby is not coming. What next? If you can't, just refer me, because it is your life. And also, delay in decision making, very important. The doctor wants to do a CS, and that is when the midwife and the patient is saying, as for me, CS, never, never, never. Please think about it before you go to the hospital. That in case of an emergency, will I take blood? Will I accept a cesarean section? Who will come and be my support person? Think about all these things. And when you are going to the hospital, go with somebody who can advocate for you. Not somebody who cannot advocate for you and anything goes, like whatever, they can even sack him out of the room, but at least the person should be somebody, because our system is such that you need somehow survive, so you need responsible people to follow you. It's not supposed to be that way, but if that is the case, then why take the risk? Go with somebody who can speak for you when need be. You understand? Okay, so my mom was a nurse, so when I'm going to deliver, she's always with me, and she would be able to know that, okay, at this time, if this thing is not going well, then this has to be done. It's advocacy, or your husband, or that support person. We don't have a lot of downless here. It's not so common. I don't think anybody has started, but to somebody who can advocate for you, because until we do that, we'll still have some of these cases. Take your medications, go for your antenatal, advocate for yourself, seek a second opinion when need be. Oh, I'm in my kitchen. Okay, so seek a second opinion when need be. Very, very important. And also report when you have any complication early. So these basic things are capable of keeping you alive. Yes, and normally I don't give it out for free, but then due to my father's the memory of my late dad, I do this. Thank you all. I think the place is hot, I'm sweating already. Thank you. Have a nice day. So you can pass it on to others to also learn. My name is Midwife Sally. You can find me on Facebook, on Twitter, and also on Instagram. It's all Midwife Sally. Thank you. Bye.